I'm Dr. Alan Nasar. I'm an orthopedic surgeon at Advanced Orthopedics and Sports Medicine Institute in Freehold, New Jersey. I'm here today with Gail Allen, a patient of mine. Could you tell us, Gail, what first brought you to our practice?
Well, when I was a member of I am a member of Central State Fitness Center, and a number of women have problems there. So I was talking to a few women who had hip replacements, and they had it done with you. A good friend and neighbor of mine also came to your practice, and she had given me your name as well. So I had decided that I would come here since I, had
Good.
some personal
So you
recommendations.
had some ties to Central State, and
Right.
the word of mouth led you in our direction.
Yes.
That's great. I think that's the best way to have patients come in. And now we're talking about the problem that you have or had. How was the pain in your hips when you came in?
Well, I had a lot of stiffness, more stiffness than pain, which I later learned that that's called pain also. But, I just referred to it as stiffness. So over the past year, I really had a lot of difficulty walking. And that was, due to the stiffness and degeneration. So I said, I can't live like this any longer. I had tried chiropractic. I worked with the trainer at the fitness center. I had some physical therapy sessions, and everything helped a little, but it wasn't going anywhere. And I had always been afraid of surgery. Like my mother had, on 2 separate occasions, both her hips replaced, and I had seen what she had gone through, 25 years ago, and I wasn't looking forward to it, but I knew at this point in time that was it. That was my option.
Suspected that
Right.
that's where things were going.
Right.
When surgery was mentioned, you asked about the anterior approach. Is that correct?
Yes.
And were we able to answer all of your questions and tell us, how you decided that might be for you?
Yes, you were able to answer all my questions and put me at ease that this would be easier on me since I needed both hips done at the same time.
Yes, so the anterior approach does allow basically both hip replacements to be performed at the same time, or one first and then the other in this situation. And it is ideal suited to very active patients such as
Right.
Gail, who want to get back to doing what they like doing, and you can do both at the same time. So if you were going to stage it, you'd have one surgery, recover from it, and then maybe a month or 2 later have another one. This combines everything into one. But you do have to be brave to go through it.
Right.
When we were preparing you for the surgery, as far as getting the test and the clearances, can you comment on how you felt the surgical coordinators helped you through that process?
I thought it was a very easy process. There were no glitches. Everything worked out fine.
Great. And did you go to the total joint preparation class?
Yes, I did, and I found it very helpful.
And that's through Central State.
Yeah, they answered a lot of questions, so it was very good.
Okay. So the surgery was on February 9th of this year. And after surgery, how did your recovery go?
The first week was hard.
Yeah.
It was a little more difficult than I had anticipated. But once the first week was over, everything just kind of moves quite rapidly. Every day I can feel better.
So you were in the hospital for about 3 days.
I was in the hospital for 3 days.
And then where did you go next?
And then I went home.
You went right home.
And that was the best move for me.
That's great. And then we do have services at home. Maybe just let the...
Yeah, I had a terrific physical therapist, Anne, who came from VNA, and it was terrific because you were given direction of how to move around in your own house. I mean, I came home on Thursday, and Monday I was up and down the stairs.
Yeah. So they come right in and help
Yeah.
you navigate your house, and then
Right.
I'm sure work on getting you out of the house.
Right, exactly.
Next.
But I mean, it was very, it was very good move. But you do need somebody at home to help you. I mean,
I think
fortunately,
so.
my husband was home and retired, so he was able to help me.
Mhm.
You couldn't do it if you were living alone, but.
And where did you go next? Did you start doing outpatient shortly thereafter?
So then, after I had home therapy for 2.5 weeks, and then just 2 weeks ago, I started at the Central State.
Oh, so you're back to Central
Right,
State.
right, because I had gone there prior.
Yeah.
So
I'm sure they're happy to see you.
yeah, I have the same physical therapist that I had before, so I
That's
thought,
great.
she knew what my limitations were, and when I came in, she was surprised at the range of motion that I had.
It's nice to be able to see
Right.
someone before and after surgery because you really
Right.
have that connection and the history
Right.
with the professional. So you're 5 weeks after the surgery right
Yes.
now, 5 short weeks. And how do you feel as far as, how much recovery have you had and the pain and the symptoms?
I feel great. The my right side, I can probably say, is almost fully recovered. I don't, have any problems with the right. My left side, which was my worst side, is still recovering. It's very good, but it's not. I know it's not 100% yet. But each day, it's getting better.
If you compare before surgery to now, how much of improvement would you
Oh,
say?
probably, I don't know, 75, 80%.
So you noticed like right away.
Oh, definitely,
the
right
change.
away. Right away. I mean, my son said to me the second day on the walker, he said, "You're faster now than you were before."
Oh, that's great. Glad to hear that. So just a couple, almost done. We'll wrap this up. How would you describe your overall experience with our group, with Advanced Orthopedics?
I was very pleased. Everybody is very polite, very helpful. You did an excellent job.
Thank
You told me what to expect, and it worked out,
Good.
just as expected.
Yeah, especially with joint replacements. I mean, we really do try to have everything made easy for you. The
Right.
system, the classes, the education, the
Right.
information we give you. We don't give it to you once. We kind of try
Right.
to repeat it, and this way nothing is missed and everything
Right.
can happen smoothly. But I appreciate your feedback.
Yeah.
And then looking back, if there was something you could tell your pre-surgery self, or I guess someone else with a similar problem, would you have any advice to them?
Well, what I did and what I think helped me is because I'm very active, I stayed active, and up till 2 days before, I still went to the gym and I went to my water classes, and you do what you can do.
You pushed yourself. To
I
limit.
pushed myself, and I feel that helped because after the initial surgery, like 3 or 4 days after that, every day I could start feeling improvement, and I think it's because I was prepared for it, and I think that would be my suggestion: is prepare before.
I think that's a good suggestion.